So first, I want to show you the PRP. And remember, that's platelet-rich plasma. So here, we've already drawn up a vial of Carlos's blood earlier. We put it in the centrifuge to spin for about 10 minutes, and out came liquid gold. And that's what's in this syringe here. And that's what we will be injecting. And it's rich with the platelets, with the stem cells that are going to trigger the hair growth in Carlos's scalp. So let's begin. Because this is a medical procedure with blood-borne products, my assistant and I will be wearing a mask and goggles to protect ourselves, and I will have Carlos close his eyes so that there's no splashing of the product when we're injecting. All right, let's begin. Prior to the procedure, we've prepped Carlos's scalp with some alcohol and cleanser. So now we will begin. Very nice in terms of helping with the injection discomfort is the use of a distraction device, this little yellow gold wand here. And what it does is it gives little pulses next to the injection site, and that really helps with the discomfort that Carlos may have, although it is mild in general. Okay, so we'll begin. So Katie, you can follow me around. You do have to do a series of treatments in the beginning, and usually 6 to 8 over a year span. And that's because hair cycles in a very slow fashion over a year. So we treat it back to back for that whole year. And then if we've gotten good results, which most people are getting, we maintain with a maintenance or booster injection, just one, not a whole series, every 3 to 6 months, depending upon the patient. Important to know when we're doing these treatments, and we discuss with the patient from the beginning, is that all treatments work in conjunction with a good home regimen to help the results come in faster and to maintain. And that will include, usually, a hair restoration kit that we customize here at Nichols MD of Greenwich for each patient. Patients often ask what to expect in terms of hair growth if they're successful. And I usually tell them in terms of visible hair growth, those first hairs coming in, usually on average, it's about the 3rd or 4th treatment that patients will start to see something, even though there is growth going on underneath even earlier. How you doing, Carlos? Well, good news, we're done with the treatment. Katie's gonna clean off your scalp, and then she's gonna do a nice little 2 to 3 minute scalp massage, which patients love because it feels good. It also helps to disperse the PRP. In terms of what to expect after the treatment. So for most patients, really not much. I mean, some patients may have a little bit of a headache or something. Afterwards, they can always take a Tylenol. But besides that, most patients really don't feel any discomfort after the treatment and go right back to their normal activities. So hopefully by about 3 to 4 months from now, we will start to see some hair growth in Carlos's scalp, which hopefully will get better and better over time. So if you have any questions or want to learn more about PRP,